my baby. Get right back to What's up, everybody? This is Vivian Green, and you're listening to the podcast on RollerBeast.com.
It's the Will Levy Show. Healthcare has been in the news to repeal and replace the Affordable Care Act, also known as Obamacare. We often hear the political talking points, but don't often get a sense of how this all affects hospitals, patients. In studio is Steve Hess. He's Vice President of Riverside PACE, which is a program that helps seniors to live safely at home while receiving comprehensive care. Welcome to the Will Levy Show.
Will, thanks for having me.
Pleasure to have you as well. As I mentioned, Riverside PACE focuses on seniors, enables them to stay at home, be safe, and get comprehensive care. Explain sort of what that's all about.
Sure. PACE is a program of all-inclusive care for the elderly, and we're really serving those individuals that have multiple issues going on in their life that cause them to need additional health care, and they want to stay at home. They don't want to reside in an assisted living or a nursing home. So our goal is to keep them safe in the community and provide those services that they need. PACE is a social/medical model. So not only do we provide all of their health care, but we also provide day center services for them, transportation to and from medical visits. We provide in-home services from a standpoint of assisting them to do those things that they need to do on a daily basis in their home to stay safe. We provide Meals on Wheels services to them and surround them with a team of individuals that really provide a safety net to keep them out of the hospital setting or other institutional type settings of care.
So this is not like just dropping your parent off for a day center or being in a nursing home like a lot of people really fear. Not that all nursing homes are terrible, but a lot of people fear being in nursing homes and sort of being in a wheelchair and sitting in a corner. This is much more meaningful.
Yeah, our goal is to really keep people engaged in life and to allow them to function at a level that they're capable of, and then support them through that with all of our services. So we have registered dietitian on staff, we have rec therapists, we have physical therapy, occupational therapy, we have social work, we have physicians, nurse practitioners, a whole clinic setting that surrounds our participants with levels of care that they can't get from a single health plan other than PACE in the community as it stands today.
And the areas of Virginia that you serve are?
We are in the Peninsula Area, so Newport News, Hampton. We serve 3,300 square miles around Richmond and also the Charlottesville area. So we run the 64 corridor all the way out past Charlottesville.
Now, on the peninsula, Hampton and Newport News areas, there's been some changes, some consolidation that's going on. Talk about that. Explain to people what's happening.
Sure. There's some misconceptions of our consolidations within the peninsula area. We're constantly looking at how do we continue to provide services in a time of this country where resources are dwindling. So our payments have slowed down. We're really looking at how do we bring everybody together in a site that allows us to gain those economies of scale to continue to provide for our participants. So we actually moved our Hampton site in with our Newport News site, and we're located on 439 Oriana Road in Newport News.
And so in moving that site, because you have the PACE buses, people are still able to get to that location, even though it may be a little further.
Sure. I think probably the PACE buses are extremely visual in our community. We're everywhere, and we continue to provide transportation from all of our service area to the Newport News location.
Yeah, PACE buses are almost as well known as Hampton Roads Transit.
Absolutely. Sometimes better. We've got good pictures on ours.
Talk a little bit about how long you've been at PACE and some of the things that you focused on.
Sure. I've been here in the Newport News area with Riverside for the last 2.5 years, really focusing on, how do we continue to provide PACE services in our three markets, and how do we continue to grow the program. So we work a lot with the state Department of Social Services, DMAS, which is the Department of Medicaid Assisted Services, to continue to grow the program within Virginia. There's a great commitment by the state of Virginia to include PACE in all of their growth projections for the Medicaid, Medicare population of the frail elderly. And so we, part of my focus has really been how do we continue to do that.
You tune into the Will Levy Show at Smooth 88.1 WHOV, WHOV.org, via HiHeartRadio.com, talking with Steve Hess, Vice President of Riverside PACE. One of the things you mentioned is that Riverside PACE works with the government. And with all of this talk about the repealing and replacing, one of the issues of the bill that was produced by Paul Ryan, one of the features in there is that it's dramatically increasing costs for seniors. Now, that bill didn't get introduced. I mean, it didn't move forward. It's still out there. They're still discussing it. Talk about that and how that an increase in costs for seniors would impact PACE.
Sure. Well, that's probably an area that concerns me greater than almost any other component. Our population, our elderly population, our senior population, they are the ones that worked in this country to get us where we are today. They fought World War I, World War II, the Korean War, the Vietnam War. They allow us to live the way we live. They also, a lot of our seniors are on fixed incomes, and the Ryan Care Act or Trump Care Act, however you want to name it, really is going to put a great burden on our senior population that are on fixed incomes that can't afford to pay more for their health care. So, when we start dividing out the components of health care and we allow the higher user to be charged a higher premium for that care, certainly for the younger, adult that's 19 to 40 years old, their costs are going to be very low. But for those that are extremely ill and for the seniors that need the health care, costs are going to get to a point where they can't afford it. And when people can't afford it, then the emergency room becomes their primary care physician, and the cost to everyone still goes up because that cost still has to be borne by the public at large. So, somehow we have to figure out how do we save health care, but not place it on the backs of our senior population.
And it seems like putting so much of the cost on one segment of the population is counterintuitive to how insurance works, because what makes insurance work, whether it's your car or whether it's homeowners insurance, it's spreading it around or spreading the cost around to be able to get it down. I mean, what does that also say in some ways about where we're at or how we're thinking as a society when we're, instead of sort of sharing certain burdens, we're putting that pressure on particular populations?
Well, I think it again, this is certainly my thoughts. I think that we have to stop looking at developing these insurance pools as small lakes and look at it as the ocean. And, a larger body of people will bring down those costs, even though some of us may pay more than we would pay if we were just in the small pond. But ultimately, all of us are going to need health care at some point. And if what we're saying as a society is when you don't need it, just pay a little bit, and when you need it, you're going to pay a lot, at some point we're all going to be in that lot group. And I don't know that any of us have created that savings pool, that health savings account that's going to be allow us to afford that in the future. So ultimately, it falls on those that are paying the smaller premiums. Their costs are going to go up too.
But then on the flip side, it does seem to make sense to any typical person that says, why can't I just pay for what I need? If I'm a male and I'm 21 years old or whatever, why should I pay for health care that includes maternity care?
Sure. And that is, certainly I understand that thought process. But But also, I mean, if you think of it from a male standpoint, you do have a part in that maternity process, right? I mean, so I think that we all share a cost of the healthcare of society, and how do we as a group and a group of people, not looking at it from the standpoint of where we are income wise, where we live in the area of the country, whether we're male, female. We all share the same components of healthcare, and whether we need it today or need it tomorrow, ultimately we have to pay for it. This country, we have not figured out what some of the other countries, the more industrialized nations of the world, have figured out as far as, is there a one payer source that makes sense?
Right.
So that instead of trying to worry about can we sell insurance across state lines, the limitations that we have created were created by us. It was created by either the federal government or the state governments that prevented that. We can remove that at any time.
Yeah, and then in reading about just that idea of selling insurance across state lines, there are challenges there too, because every state has different regulations, or it may have different populations that may have, for example, obviously, Florida is going to be, because it has an older population, is going to have a different type of health need than, let's say, Montana.
Right.
There's going to be differences. So how would a health insurance company in Montana be able to compete in Florida unless they are able to provide the same kind of care? So it's very confusing. It just seems that there can be a solution to it. What do you hear among the hospital administrators and in your community? What do they say about what makes sense and what will work?
Well, certainly, the whole healthcare system in the country has been moving down the tracks with the Affordable Care Act. Mm-hmm. And, that train left the station the day that the Affordable Care Act was passed. So the train's going downhill down these tracks. To change that today is also going to add a lot of stress and strain on the system as a whole, to be able to turn around and say, okay, now we've decided that the direction that we had headed is not the direction that the government wants us to go. So we have to change directions and go back uphill and change our tracks. It's going to be very difficult. It's not impossible. Certainly, everyone thought it was impossible to get on these tracks to begin with, and we did. But it's not going to be an easy change. And some of the major components of the Affordable Care Act, I think, even those within Congress, the Republican Party, I mean, a lot of them have embraced, keeping a child on your insurance until you're 26 years old, making sure that if you have pre-existing conditions that you can still get health care. Those things in the past didn't happen. So, the focus from healthcare across the country, I think, is, what is this going to look like? How many resources is it going to take to change the way we're headed now? And will there really be a savings in the long run? Are we really addressing the issue of the insurance companies making money versus people receiving health care? So if you dig into the financial records of the insurance companies, you're going to find that if you had invested money, 15 years ago, you would be much more wealthy today than you were at that point in time, because their stock prices have grown up like crazy because they've made a lot of money during this period of time.
Right, and I think that's one of the big problems is that profit motive in the whole healthcare issue. It basically comes down to you being able to make money off of people being sick.
Sure.
So therefore, there is an incentive in there that, well, people being sick is good because we can make money off of that.
That's one of the things, Will, that, when we look at the PACE program model versus healthcare as a whole is a fee-for-service industry. The more we do to you, the more we get paid.
Right.
Within the PACE model, it's a capitated program. So we get paid X number of dollars the first of the month to care for you, regardless of what you need. It doesn't matter how many things we do to you or for you, we get paid nothing different. So our goal through the PACE program is to do things in a preventative and proactive way. Our goal is to catch that illness before it becomes full-blown and you need that ER visit, and consequently, we're able to make that work. The fee-for-service is we can do things, we get paid because we do things. Now, there is great treatment that happens through that process. I don't want to discount that. But if we can do things in a more preventative, proactive way, so people aren't having to use the heaviest level of health care, then we can reduce costs.
I visited several PACE centers and talked with participants, and to everyone that I've spoken to, they speak with such joy, and there's so many stories of people not being well, going into the PACE system, adding years on their lives. You see them really vibrant and alive. Talk about some of what you've seen and what comes to mind.
Yeah, we can do things in the PACE program because it makes sense. And I can give you an example that when I was in another program in Nebraska that happened, we had a participant that had COPD in the summertime, and her air conditioner went out on a Sunday. She came into the program on Monday morning, and she said, geez, my air conditioner went out. Well, COPD with hot air makes it very hard to breathe. So by noon that day, we had purchased her a new air conditioner, put it in her house. By the time she came home, the house was cool. It cost us about $400. An emergency room visit would have been $2,500. So we saved $1,900 just by buying an air conditioner for this person. And it makes sense. If that person had called the insurance company and said, geez, my air conditioner went out, you can keep me out of the ER if you could cover this, they would say, it makes perfect sense, but it's not covered. And so nothing would happen. This person would end up in the ER, taking advantage of, or the system taking advantage of her illness when that didn't have to happen. So we see great outcomes, not only from our participants, but the staff that work for us. I mean, there is a mission in their heart to provide services to individuals that sometimes have no one else.
Yeah, it's infectious.
We become the family.
Yeah.
And when we lose one of our family, we all grieve. So it is infectious. You're right. It is.
The Medicare expansion issue, how has that positively or negatively impacted you? Because here you haven't had that here in Virginia.
Yeah, so with Virginia's coming out with a new program. They had a dual eligible program. So those that have Medicare and Medicaid eligibility for medical services in the state of Virginia are all going to be enrolled beginning August 1 in the Tidewater area into what is called Medicaid Long-Term Support Services Program, and the acronym for it is CCC Plus. So what will happen through that is individuals will have an option. Those individuals that are eligible for PACE can choose PACE, or they can choose to stay in the CCC Plus program. We're not sure what the impact of that's going to be long-term. We know that we serve a more frail population. All of our participants have to meet the criteria of nursing home eligibility that's determined by the Department of Social Services. So that's just a small segment of the entire population that will be going into the MLTSS program, the CCC Plus program. But we think that there's a great opportunity for us to continue to provide superior services with a safety net that covers all areas of this individual's life. You can do things, Will, like if it is easier for an individual when they're doing their laundry in their home to put their washer up on a pedestal, we can do that.
Right.
Because it allows them to remain independent. None of us, I think if you lined up 1,000 people and you said, okay, when you're 87 years old and extremely ill, who wants to leave your home? I don't think there are going to be any hands fly up in the air.
Right.
We want to be in our surroundings. And through the PACE program, we can do that. And we can do that through Medicaid or Medicare expansion It's just people need to seek us out.
Yeah, I know that to be true because I know before my mother passed in 2012, she was a fighter and feisty and wanted to remain in her home, her apartment, for as long as she could. And we tried and worked with her. And then, dementia began to set in and just got to a point where it was, it was impossible. And I think it broke all of our hearts to have to, put her in a nursing home. And now my dad is 91 going on 92. He lives in his home, has knee problems, can't get around as much as he used to. But if you try to tell him about not being in his home, he'll try to knock you out.
I'm sure. We love our surroundings. We love the things we grew up with, we become comfortable with. That doesn't change because you age and you're more frail. In fact, maybe it becomes even more important to you that sometimes removing people from the areas that they're most comfortable with has a detrimental impact on their health care. We find that in many ways. There have been a lot of studies of people that have where a existing nursing home built a new nursing home and they moved everybody over, and the number of deaths that happened were extraordinarily more high in that move than they would have been in the other setting. And so there are ways of certainly doing that, but we want to be where we're comfortable and in comfortable surroundings and surrounded by people we love.
Yeah. And I know the participants at PACE, they definitely talk about how PACE is a home away from home and how they love being there and also being amongst their peers.
Sure.
And being with their friends. And a lot of relationships have developed in those PACE centers. And
there's a lot of times the individuals that come in, they didn't seek us out early enough. And so, they have been isolated in their home, sometimes hopeless and helpless. And by coming into the program and coming into the center and getting around people that are their peers, the friendships that are developed are phenomenal. And the support of the caregivers. When you're and you've gone through this, Will.
Absolutely.
When you're a caregiver, you cease to become just the son or the daughter, the husband or the wife. You become it's a schizophrenic situation. You're
everything.
Caregiver. You're everything.
Everything and nothing at the same time. Yeah,
and what we try to do is give back to that caregiver the ability to be the son, daughter, the husband and wife again, and let us do the caring. We want you to help us. We want you to be part of the solution. It's important that you're part of the solution, but let us take the heavy load. Let us carry the load for you for a while. Let us be the one that steps into your shoes and lets you go in sandals now and support your loved one with love, not with having to care for them in every single moment of their day, not to have to take off work because mom's got a medical appointment. We do that. You're welcome to come, but we'll take her there. We'll make sure that the appointment's made, she's seen, and we follow up with it. You don't have that on your shoulders anymore.
That's great. Final thoughts on how to get in contact with PACE?
Certainly, we have our website through Riverside Health System, Riverside Online. Our website is a great opportunity to give us a call. Our phone numbers are listed there, both in the Peninsula market as well as Richmond and Charlottesville.
Excellent. Steve Hess, Vice President of Riverside PACE. Appreciate having you on the Will Levy Show.
Well, it's my pleasure. Thank you very much.
Watching your aging parent or loved one decline can be stressful. They can still live independently at home, but they need comprehensive help that sometimes you are too overwhelmed to provide. Who can you trust?
When she was at home and people were coming in, I was constantly worried. But when she's at PACE, I don't worry.
Riverside PACE helps older adults live safely at home with personalized health services for their physical and social well-being.
With PACE, we offer, of course, our day center, medical care, chaplain services, the recreation services throughout the day here in the center, home care services, social work, transportation, which is key. Our goal is for our participants to live safely in the community for as long as possible.
PACE is a God-given place for you to be at. If you got an old mama or the old daddy, Bring them to PACE. That's the place to go. Come to PACE.
Riverside PACE services may be provided at no cost to those who meet certain financial criteria. If you or someone you know is 55 years or older and lives in Richmond or Southeast Virginia areas, call Riverside PACE now at 757-234-8100 or 804-977-5900 or visit riversideonline.com/PACE. PACE is a program of the Commonwealth of Virginia and the federal government.
You've been listening to the Will of East podcast at willofeast.com. Follow me on Twitter, Facebook, Instagram. Go to my website and sign up for the e-blast to learn what I've got coming up next. And check out the website for where you can listen to the show live. Until next time, take care and God bless.